Do this mask before and after. You have to try it, Tash. It's amazing. Then I have all of these masks lined up on my bathtub that I will customize my mask according to the area of my face.
So if I were to be going out tonight, I would be exfoliating with... This is Skin Talks, the podcast where we go deeper than skin, products, and trends and explore the conversations that actually matter in health, beauty, wellness, and confidence.
We're a mother-daughter duo and the founders of Boutique Skin Envie. After years inside the industry, we've learned that health is never just about what you use. It's about everything you digest, how you think, how you live, what you eat, how you move, what you put on your skin, and how you feel in your own body.
If you're looking for insight, honesty, and a fresh perspective on the future of health, beauty, and wellness, you're in the right place.
Let's get into it.
Skin Talks podcast by Boutique Skin Envie, hosted by Beate and Natascha.
Happy almost New Year and welcome back to Skin Talks, where we keep things real about skin, science, and self-care.
This is one of our favorite episodes to record because it's the calm before the big year. It's that day when everyone wants their skin to look healthy, hydrated, and maybe even a little bit snatched before heading out tonight.
So we thought we'd keep this one short, light, and fun, our favorite holiday skin hacks that actually work. These are things that we're personally doing right now to bring our skin back to life after December.
From gentle exfoliation to masking to a few pro tricks like face taping with Sealed, this is your realistic guide to glowing into the new year. So this episode, we're going to go over how to get ready for your evening, whether that's staying in or going out, and then how to recover from it the next day, which we're really excited about. I know for me personally, I will not be doing anything tonight. I'll probably be going to bed early, but nonetheless, I do want to go into the new year looking my best. So I will be doing some things.
Yeah, absolutely. And I just want to bring one thing, I want to talk about one thing. So, I recently had a deep resurfacing peel with a device called Fotona. I have to say it was like a humongous experience. I'm on day 6 right now, post-recovery. So we're talking about prepping and recovery and all that kind of stuff. So one of the things that I did that I just felt was really important to share, and by the way, you're going to notice I'm a little bit swollen still under my eyes. I'm still red and I have some concealer on and sunscreen, of course, was this new mask that we launched at Boutique Skin Envie around... I think we launched it in November, maybe the end of October. I can't remember. But the brand actually recommended that I do it post Fotona and then after Fotona. Sorry, pre-Fotona and then post Fotona. And it's called the CO2. So if you go on Boutique Skin Envie and you search for CO2, this mask is going to come up. And I swear to God, it was a massive game changer because what it focuses on is really re-oxygenating the skin, prepping it, and at the same time repairing it. So I think it was really an integrated and one of the most important factors in my healing. So what I would recommend for you today, if you're going to go out or if you're going to stay home, is try this mask. You are going to notice a difference in your skin immediately. And if you're going to do any procedures in the new year, do this mask before and after. So let's say microneedling or any kind of laser treatment. You have to try it, Tash. It's amazing.
Yeah, when I can start doing treatments again, I will.
I know. I just had to pop in with that because I was so blown away by the results of it. It was a girlfriend that told me about it. And I was just like, I just think it's absolutely fantastic. So, and even if you're like tonight going out, you want to do a CO2 mask, and then you want to do a lifting mask or a radiance mask, for example, you're going to deeply, deeply hydrate and repair, reoxygenate your skin, and then you're going to make it glow,
Yeah.
So.
But start with an exfoliation for sure.
Oh, always.
And
yeah.
I always go for an exfoliation that's enzymatic.
Mm-hmm.
I'll never really do a mechanical exfoliation because I actually don't really like it. But I love enzymatic exfoliations because they're very gentle, but they work really well. And then obviously I would top with a mask.
Yeah. There's different schools of thought around exfoliation.
I know. Some people think that it's totally fine. Like as long as my philosophy around it is like, I've used, for example, the Zeo Skin Health, the exfoliating polish. That's an amazing exfoliating polish, but I personally don't love it for my skin. And I just feel like a lot of people forget that you're supposed to be gentle with your skin and then over exfoliate, which is where you can cause issues. Like you exfoliate for too long and you put too much pressure.
Even though Zoe is part of their daily protocol for acne prone skin, for everything.
But I just
actually
don't trust
really,
people enough to do it
you
properly.
have to be very careful.
Yeah. So that's why I don't usually recommend it, because I just feel like I can't trust people that they're going to do it properly. And that's myself included.
Yeah.
But I think enzymatics, or like, for example, the Biofora enzyme exfoliator, that has the tiniest bit of granular. It's like almost not even beady. It's kind of like all one consistency. It's very hard to explain it. That one's a nice one.
Yeah.
As well. And it smells like licorice, which I love.
Yeah. I have not tried that. I need to try that. But another one that I really love is from Skin Medica. It's called the AHA BHA cleanser.
Yeah.
And I've used that. Again, you have to be careful with it though. So it's like a dual action exfoliator, and it's also got salicylic acid in it. So it helps to really.
But then like if you look at Jan Marini, the bioglycolic cleanser, like for me, that's like, that for me is like
heaven in a bottle.
Yeah. That's like 10 times better than any exfoliation I'm ever going to do. I feel like that, I really feel like my skin is clean and genuinely looks like it's exfoliated.
Well, Jan Marini is a daily cleanser. You use it morning and evening. I mean, you have to acclimate to it, and never on the eyes, but it's got 10% glycolic acid in it.
Yeah.
So you're definitely very gently exfoliating your skin.
Which is why I prefer it more than another one, just because I feel like that you can't really go wrong unless you put in your eyes, which I did once. So don't do that. But I
remember you did that.
Yeah, it was like I came home drunk and I did it, and I thought
my
eyes
Mom.
were coming out. It was a disaster. But yeah, so those exfoliations for sure is a great way to prepare your skin for an evening, because your skin's going to be glowing after. It's going to be more hydrated. It's going to be like refreshed, but it's also going to help your makeup stay on longer.
Absolutely.
And the application of the makeup is going to look better on your skin as well. So that's stuff that I love to do, whether I go out for like a dinner or whatever it is, like regardless of the occasion, I'll always exfoliate.
Yeah. What about skin tools?
Well, I use skin tools every day because I currently can't use anything else.
Because that could be a fun thing to do tonight or today before tonight. Using like the ice roller from the Skinny Confidential, or one of the gouaches from Mount Lay.
Yeah, if you feel like your skin's like, what do you call it? Inflamed, not inflamed, but puffy. You can use the ice roller. If you want to have more of a snatched effect, I would use the New Face microcurrent device.
Oh yeah.
Or the gua sha, which is also just a very nice like self-care moment that you can take for yourself, where you're just massaging your face. I also find when I do it, like my skin gets a little red after, but I'm like, there's like a circulation and movement. It's like getting massages for your body. Mm-hmm. It's sort of the same concept on your face, and you're like releasing a lot of tension in your face. I love to do it here if I clench, which is like my jaw area. And I love it on my forehead because I find it like helps with headaches. Mm-hmm. But gua shas are my favorite, just because it's like a massage for your face, and there's nothing better. And then if you do a specific techniques, you're doing lymphatic drainage and you're lifting your skin.
And you're also depuffing just by doing that with the lymphatic drainage. You have to make sure though, always when you lymphatically drain, you have to drain it out of your face. You have to pull it down, right?
And then we also had this interview from a while ago with the owner of De La Harte, and she said that there's certain tapping techniques that you have to do around your collarbone, underneath your armpits, and then I think also like tapping where your ear is, just like little taps, and that opens up your lymphatic system.
And it also is very calming. Tapping is very calming. So give me your typical evening or routine to get ready for, like, what would your ideal routine look like as you head out into the new year?
So if I were to be going out tonight, I would be exfoliating with probably the Biofora enzyme exfoliator, because I love it. And I would be doing a mask.
Which one do you love? Your favorite?
I personally love the Hydrinity, the HA mask. I don't know the real name of it.
Really? Oh, you've tried it. I know I've tried them too, but I'm surprised I didn't know you tried it.
Like I'll hop into it. Like I actually don't like sheet masks that much because I find they don't sit on my face properly, and it's like a sensory thing where like they feel like they're falling off. If I take a bath and I'm just lying there and doing nothing, then it's the best time to have a face mask, like a sheet mask on, because you just won't move, and you're in there for 30 minutes and like you're just absorbing all of the good hydration. And the Hydrinity HA mask is like full of hyaluronic acid. It's amazing. Your skin is like juicy after. If not, it would also be the Biofora multivitamin freeze
Face
mask.
mask, yeah. It's a
That's
great one. It's
really good.
very calming and soothing, and
Yeah.
it's great for all skin types. But before you get into that, Tash, I wanted to ask you, have you ever tried the sheet mask from Epicurus?
No,
'Cause
no, I don't think so.
It's also amazing. I love the one from Hydrinity too, I agree. And you'll have to try, we just brought in, I think like August, September, we brought in these really interesting masks. I don't think you've tried it yet from Soke, Soke. They have one for the eyes, they have one for the face, and they also have one for the neck and
Yeah,
décolleté.
it's hard for me
No,
to.
no, no. Eyes, neck, décolleté. You don't see a lot of brands that have décolleté
No.
masks. And this is like, you have to try it. It's amazing.
Yeah, like I said, I don't love sheet masks, which I never really gravitate towards them. But if I'm gonna take a bath, I'll definitely try them, because that's where like I feel like I can actually just like fully relax. And like if I'm doing things, also like you can't drink when you have a sheet mask on. Like you can't have it. Like it's just very difficult to do anything or like eat.
But the Soke one is different.
So I'll
It's
try
really cool.
that. But then also another one, which is like very bougie of me, I have to say, is the Valmo Prime Renewing Mask.
Oh yeah, that's a cult favorite.
That's like not budget friendly, I would say, but like so worth it. Like your skin is amazing after,
It is.
and you just feel very luxe when you put that mask on.
I think that's their number one selling product.
Yeah.
And we sell it like crazy. People just love it. And I think it's $375 for
like
75 mLs. It is 75 mLs, but still, if you want to splurge and give yourself a big treat this year, definitely.
Yeah.
Definitely a cult favorite. And we often include these things like the Soke, the masks, the sheet masks, also the Valmont Prime Renewing Pack. We put it in our Glow Fix boxes. So look out for that in the new year.
Yes, definitely worth trying. And then, I mean, I would then take my mask off, and then something that I do is I would just apply my moisturizer. I don't do my entire skin routine, because I know that when I come home from my night out, I'm going to obviously take my makeup off and apply my skin routine. So I don't need to apply my routine in the morning, going out, after going out.
Yeah.
So I just will put my IS Clinical
It's kind of a waste too, right?
Yeah. And I just don't think that it's necessary. So I put my moisturizer on, and then if I feel like I need to like depuff, then I'll do the gua sha, and then I'll just put my makeup on, and then I'll head out.
Okay.
And then I'll come home and I'll take it right all off. Very important to clean your face.
Let's talk about hydration, because dryness and dehydration are not the same thing. You can slather on a moisturizer and still feel tight, dull, or flaky. And that means that your skin is dehydrated, lacking water, not oil. Hydrinity's restorative HA serum uses medical grade hyaluronic acid and regenerative peptides to deeply hydrate at a cellular level and repair the barrier from within. The glow, the plumpness, and the bounce, it works fast, and our clients get hooked. If your skin drinks this up in seconds, it needed it. Use code SKINTALKS15 at bskinenvie.ca, spelled BSKINENVIE.ca, for 15% off your first order. Well, I have to say, I'm not somebody that really like goes crazy over New Year's Eve.
Me neither.
Ever. I kind of see New Year's Eve as a very restorative time. And I'd rather be with a bunch of girlfriends or have a quiet dinner with just a couple people than to go out into a big party. I was never, even when I was a teenager in my 20s, I was never a big person for, expected events kind of thing, or like anticipated events.
Yeah.
But definitely one of the things that I like to do is when I work on my face, I often do it on Sundays. It's my self-care Sunday kind of thing. I really try to take the time to give myself permission to relax and restore, because I find what it does is it rejuvenates me, also makes me think about things that I don't have the chance to think about during the week, Yeah. So one of the things that I like to do with my skin is I will definitely exfoliate. One of the exfoliators that I have in my bathroom right now, and I do bath too, so we have that in common. I'll always take a bath on Sundays. And what I'll do is I have something called the Tri-Active Exfoliator from IS Clinical.
Oh, there's also the warming honey cleanser from
That one's, that's like an enzymatic one.
Yeah. But yes,
But
that
the
one's
tri-active one is very interesting because it's an enzyme combined with
a
the
newer
granules. No, it's not. But it's a product that is really, I think, misunderstood because it's not one of our top sellers.
It's a mask.
An exfoliating mask,
Yes,
right?
yes, I've tried this.
So what you do is my trick is I obviously on clean skin, because you should always exfoliate on clean skin, is I'll put it on my face and I let it sit there for a minute or two, because what happens with exfoliators or enzymes is when they heat up, they kind of like liquefy a little bit, which gives because the product is very thick. In fact, it's hard to get out of the tube.
Yeah.
So you really need to.
And it's recommended to do it when you're in a bath or when you're in a shower, because you need the humidity.
The hotness. You need the warmth around
Yeah.
you, and your skin is already warm. So anyways, like I said, I keep it on and then I very, very gently exfoliate, and then I'll leave it on my skin for maybe 5 or 8 minutes after it. Then I rinse. And then I have all of these masks lined up on my bathtub that I will customize my mask according to the area of my face.
Yeah, that's cool.
So I'll use something like the what is it called? The sulfur mask. It used to be called the sulfur mask. The complexion renewal mask.
Complexion clearing mask.
Clearing mask. And I'll put that in my nose and where I find my pores are larger on my face, because what it does is it really draws out the oil. So it kind of will make your pores look more refined. And then I'll layer in a different mask around my eyes. I love the Age Intervention retinol mask from Jan Marini Skin Research. For me, it's incredible. I'll put that one around my eye area because it's got retinol in it. So it really has a smoothing effect. And then I'll take things like the Masque Vivant and I'll mix it together with the VIPO2, for example, and I'll put that on the rest of my face.
Yeah.
So I kind of look like a little bit of a mess. I have a mirror that I do it in.
No, but it's kind of
But I'm customizing. It's like I'm giving myself a mask facial, but it's really to the different areas of my face that I feel are lacking vibrancy.
And if you suffer from acne, you can do the complexion clearing mask or any purifying mask in that area of concern. I would put the Jan Marini, what's that one? The Marini Illuminate mask on my forehead.
An incredible one.
And then I would do different things elsewhere. You can just kill 10 birds with one stone.
Right. So the way I see masks also, and I think masks can be misunderstood. Masks are kind of like that super boost in an area of concern. So on the daily, morning and evening, you're using your cleanser, your serums, your moisturizers in the morning and SPF always, and then eye creams and stuff like that, extra things. At night, you incorporate in retinols and stuff like that. But then once a week, you do the masks, and what they do is they go and reinforce an area, but they're not long-term results. A mask you put on your face for between 10 and 20 minutes, depending on the brand. You always have to follow the instructions, but it's to give you a push. So it's like ironing your clothes and then you wear them.
Yeah.
You know what I mean? So that's what I love masks about. So if you're going to do anything today to prepare for tonight, no matter what it is, even if you're staying home,
it's still also nice just to take a moment for yourself and
it is.
Do a skin routine,
and it just brings you back to the present and just, just taking care of yourself, which is something we forget.
Does resolutions, then you can do a mask and a resolution at the same time.
Or set intentions, review.
And then the next day, then you go out. Ideally, you're washing your face when you get home.
No, not ideally. Do it.
Let's not go into the new year with a dirty face.
Yeah, because it's going to be probably after midnight. So you want to make sure you start your year on the right track. And one thing that is absolutely a non-negotiable is cleansing and doing your skincare routine at night, even if you've had too much to drink.
Yeah, you already are dehydrating your skin so much by drinking and obviously your body. So you're already not doing yourself necessarily a favor, but I mean, it is what it is. And then if you don't wash your face, it's like all the makeup's just sitting there and going into your pores with the
asphyxiating.
It's not cute. It's not a vibe.
No.
So
not
definitely
recommended.
wash your face, do your skincare routine so you can wake up looking semi-glowing the next day. And
even if you're
puffy,
feeling lousy.
If you're feeling puffy, which is normal, then I would do the ice roller from Skinny Confidential. And I would have that in the fridge the night before. And I
even keep mine in the freezer.
Yeah, that's a little intense.
No, but I keep it in the freezer. But if you do keep it in the freezer, because it's insane how good it feels. you got to let it sit for 5 minutes before, because don't start rolling that on your face because it could stick.
Yeah, it's like when you put your
It's
tongue
like,
against the cold pole.
like you don't want
which
that.
is why I recommend putting it in the fridge.
It's just a different experience.
And then you really depuff and get rid of that puffiness, and then you can gua sha again if you want, or use another tool, or do the new face microcurrent. Like, do things so that you're taking away that puff and you're looking as snatched as you can be, depending on how your night went.
Yeah. And don't beat yourself up if you went out and had too much to drink or danced too much, or
You're having a good time.
you had a good time, and that's important to celebrate.
Yeah.
You know?
Definitely. And then, yeah, just make sure you do your skin routine and drink lots of water, electrolytes if you've been drinking, and, you know, do the
But I
best
mean,
you
there's a
can.
lot of people today that don't drink anymore, right? Or drinking, I find, is
The newer generation doesn't drink as much.
even myself. I'm very mindful of. I've become mindful of drinking. I like wine. First of all, I'm not a hard alcohol.
If you're like in your 20s and you're going out, like these.
There's still a lot of people that aren't doing it anymore.
Yes, like I said, the newer generation, I think my theory is because of COVID, they don't drink the same way that I grew up drinking, or that you grew up drinking.
Oh, yeah. Drinking and smoking for us was a big thing.
Maybe, yeah. I think because weed is legal, maybe kids smoke more weed now.
Maybe. Or like other recreational things. Not recommended,
To each
but
their own,
not. Yeah, exactly.
Yeah. Don't beat yourself up over drinking. Have fun. Just drink water at the same time.
You enjoyed your evening, and now it's the 1st of January, which is tomorrow. So, other things that you can do is just think about intentions. I'm not a big person for New Year's resolutions and all that, but think about last year, and think about what happened last year, and then reflect on how you want to see this year look for you.
Yeah.
What kind of things do you want to manifest in your life? What are, your top 3 things that you're looking forward to this year? And, always keep your health. If you can, and if you want, always keep that as a
top of mind.
Yeah, top of mind, and as a priority, because, we have one life to live, and we have to live it to the best of our ability.
Yeah. And if you haven't listened to our previous podcasts, our episode at the beginning of December, we talk about kind of like setting intentions and like doing like how we feel about resolutions, and not doing resolutions for like the entire year, but make small little changes in your life for the outcome that you want. Don't like set up this big end goal and then not be able to achieve it. So if you want to go listen to that episode, go do that, because we have a lot of great content in there.
Yeah. So whether you're heading out or staying cozy tonight, remember that good skin isn't about perfection. It's about consistency, hydration, and those small moments of care that make you feel grounded.
Exactly. The real glow is how you feel, calm and confident and connected to yourself. Because when your skin feels good, everything else follows.
And that leads us perfectly into the last episode of the year. We sat down today with Dr. Nadia Hagenimana, an ENT surgeon who's also practicing aesthetic medicine. She believes that beauty is part of healing, not separate from it.
She shares how surgery, self-image, and confidence all intersect, and why feeling good in your skin is a form of medicine. It's such a thoughtful, grounding way to start 2026.
So let's take a deep breath before midnight, enjoy your evening, and remember, caring for your skin is caring for yourself, inside and out.
We'll see you in the new year for a full episode with Dr. Fernandez, wishing you a happy, healthy, glowing start to 2026.
So you're an ENT surgeon and an aesthetic medicine provider. Can you tell us a little bit about yourself and what drew you to medicine?
Yeah, so it's a long story that I'm going to make short for you guys.
Okay.
So I started my interest in medicine when I was like in high school. So in Quebec, we say secondaire 3. So I was like, and we did biology course and dissection. And I was like, this is what I'm going to do. It was a heart. So I was like, I'm going to be a heart surgeon. And that's what drew me to medicine. So I decided to go into med school. And then finally, while doing medicine, I was like, heart surgery, not for me, not my style. I'd rather do more, it's very tiny, the heart surgery, but ENT was more my thing. Yeah, it's more diverse than I feel like regarding cardiac surgery. So that's why I decided to be an ENT surgeon.
So for those who are listening, what is an ENT surgeon? Like, what does your day-to-day look like?
So an ENT surgeon is ear, nose, and throat surgeon. The real name is otorhinolaryngologist and head and neck surgeon. So that's like the real big name. But ENT surgeon usually is easier to say for patients. So my day to day, I have a specialty that is part medical and part surgical. Most of the days I do clinics. So I see ENT patient coming in with complaints like trouble hearing, trouble breathing through their nose, snoring, sleep apnea, also neck masses like thyroid cancer or salivary gland cancer. And once every week, I do an OR, so I do surgery. So I operate all those patients that I saw in clinic. And yeah, 4 days per month, I do aesthetic medicine. So I do injectable lasers, I do consult, I do a little bit of derm because in ENT we do a lot of skin cancer and skin lesions. So I do that also in my private practice in aesthetics.
Okay. And that's really curious. That's amazing, actually. Like, how did you decide to also bring in aesthetics? Is it because you kind of already are working with the face? You were also intrigued by this different segment, let's say, or was it something else?
Yeah, it's exactly that. So I started doing aesthetics right out of residency. So I finished in 2017. That's going to tell my age, but I finished in 2017 and I went in right away. I had a friend who was working in an aesthetic clinic. She told me it was amazing. She loved it there. And facial aesthetics always interested me. And I was finding it very interesting that there was no ENT at the time that was doing that in Quebec. And I found it bizarre because we're really well versed in all face stuff. So as I said, we do skin cancer surgery, but we also operate a lot in the face, whether it's salivary gland, nose. So I was like, we're like very, very versed in that. So why not doing it? It's going to be complementary with my practice in ENT, yeah.
So, but in your surgery, you don't do any type of plastic surgery with it when it comes to like the skin on a topical sense, like for the cheeks, or do you do that as well if somebody's got a cancer or something in their mouth? Or
we do skin surgery, as I said, skin cancer surgery. So if there's a cancer on the cheek, on the nose, on the lips, on the eyebrow, everything. So we do all of that. I don't do specifically aesthetic surgery. I used to do functional rhinoplasty when I started, but I stopped doing that because I didn't have time with all the other things that I was doing.
Yeah.
But yeah, some of my colleagues are doing also, autoplasty. So when people have I don't know how to say that in English, oreille décollée. So
the ears, when the ears are like when they stick out. I don't know what that's called either.
Yeah, exactly. So
I'm not 100% sure.
They do the pin down surgery. Yeah, so I have a lot of colleagues doing that. And more ENT are now doing facial plastics in my region. So now it's more common things.
Yeah, it makes sense because it's like you're already working with the face, right? So you understand the whole structure of it, I guess. I'm like trying to find the scientific words, but I'm like...
it makes sense that you would link the two together. And I'm surprised that there was nobody, like you said, you were one of the first doing it in Quebec, right?
Yeah, exactly.
Amazing.
And just for like a personal, like which one do you have a preference on what you like doing more? Like, is there the aesthetics or the surgeon part that you like to do more? Like what's really your calling, let's say?
I'd say surgery, because if you ask any surgeon, they would say they love to operate, they love to do it. That's why they went into it. And we're doing clinic just so we can book patients in the OR. So that's the thing I love the most. It's impossible in the system that we have now to operate 5 times a week. That only happens when you're a PGY5 resident and then you operate all the time. But I'd say injecting is also something that I love because for me, it puts my brain to off because it's not as difficult and technical as surgery. So I love doing that. And the patients are different. It's not patients with complaints, with pain or anything like that. So it's easier on the emotional side. So patients, they're coming in, they're happy with their lives. They just want to, the cherry on top to look good.
Yeah, for sure. It's probably 2 completely different aspects of the industry. Like one is very aesthetic and like, I don't want to say surface level, but if like a little bit more, whereas the ENT is much more like really solving issues,
Yeah.
right? Like sleep
More
apnea.
Exactly.
serious,
Yeah.
more serious. But do you see the same
Exactly.
patients coming from your surgery practice into your cosmetic practice? Like, is there a cohesion between the two?
It's pretty rare. I'd say patients that come in ENT, they're not there for the aesthetic part. I don't think they know they can, ask for aesthetic treatments and stuff like that. Some patients have followed me from ENT to aesthetics for, toxin, fillers and stuff like that. And mostly laser, I would say. But usually patients, when they have a cancer, they're really happy you remove the cancer. They don't want to talk about the aesthetic part
Yeah.
No.
is since the scar is not that bad. It's not like,
Yeah.
full-blown mastectomy where you lose a complete breast. You have reconstruction. In the face, it's mostly a scar. We remove the stuff underneath the skin, so it's not that bad, I'd say.
I want to talk to you about one of my favorite products from SkinCeuticals, the Triple Lipid Restore. If your skin feels tight, dry, or just unbalanced, especially in the colder weather, it's often a sign that your lipid barrier needs support. Triple Lipid Restore from SkinCeuticals replenishes the skin's natural fats, ceramides, and cholesterol, as well as fatty acids. In the exact 2:4:2 ratio your skin needs to repair itself. It's more than hydration, it's barrier restoration at a cellular level. The result is skin that feels instantly softer, stronger, and visibly healthier. Find Triple Lipid Restore at bskinenvie.ca. That's bskinenvie.ca and use SkinTalks10 for 10% off your first order.
I want to speak a little bit more to the aesthetics industry. What do people misunderstand the most about the aesthetics industry, do you find, working with your clients and patients?
Mostly people think that it's superficial. And the other thing is that people think that if you get injected or if you get aesthetic treatments, you're automatically going to be looking like you're injected. So you're going to look fake. You're not going to look yourself. You're not going to look natural. You're going to look frozen if you have a toxin. You're going to look overblown if you have fillers. So this is like one of the biggest misconceptions that I see, mostly on social media or people who don't know at all about aesthetics. Yeah.
Yeah, I think that when it became really popular, like especially the fillers and stuff like that, it was just like it happened so fast. And the idea for me when I think about aesthetics medicine is like there's so many women and men walking around on the street and they've had work done and you have no idea. And that's what
Exactly.
it should be, more or less. But I definitely understand why there are some like misconceptions and fear based around where, let's say, like it was a bad job or like there's an expression I think in the industry where it's like a little bit more overdone.
The integrity of how much to fill or how much to do is sometimes not always equal, I think, in our industry, right? Depending where you go. And
exactly.
Yeah.
Which leads me to ask, like, is there any time in your treatment room that you say no to people?
Yeah, all the time.
Okay.
Mostly I would say it's for lips and cheeks fillers. And also sometimes with a tear trough, because patients are not good candidate for tear trough fillers. People who have a lot of swelling on their eye, who have festoons, which are more like surgical stuff, or if the expectation is too high for what I can give to the treatment. This is the main reasons I'm going to say no. And as I said, for lips and cheeks, some people, especially in the beginning of of my practice, people were injecting only lips and cheeks and lips and cheeks and lips and cheeks. And now I just said chicks, but I mean cheeks. So people were always getting injection there. So they were looking with overfilled lips and really big cheeks. So they were looking kind of funny. And I was like, we need to do something else. We need to dissolve. We need to do the temples. We need to do the cheeks, but lower cheek. We need to do something else to balance everything out. And so I used to say no a lot to that. But now I see that people have gone down with the lips and cheeks combo. And now they're more about the natural stuff. So we do a little tweak here, a lot of biostimulator, skin booster. People are more interested about skin quality rather than just filling the face. So yeah, there's a shift there. There's a
So
shift.
I wanted to
amazing.
ask you with
That's
that,
good.
like, how do you manage people's expectations? Or people that come in and show you a picture of somebody they want to look exactly like. How do you deal with that? So that's a kind of social media expectation.
So I feel like this has been a phase. In the beginning, it was really, really strong. People were coming in with especially Kylie Jenner's lips, and they were telling me, I want those lips. I want exactly the same thing. Now people are beginning to understand through education, probably through social media or seeing, a reasonable practitioner, that we cannot just take something from someone else and just put it in your face and do it like that. It needs to fit your face. It needs to fit your features. So people are being more reasonable on that side. But I still manage expectations through, a good consult, a good facial analysis. It's a process that the patient is part of, so is actively participating in the decision. I understand their concerns, but I also have to make a plan regarding their face. So yes, if you come and you tell me you have this small tiny line here, but I see that, you have a lot of lines that need toxin and you need some filling here and so I'm going to tell them. And sometimes it's a process. It needs to make its way through their brain. And then maybe the first time I'm going to just fill the small line. And the next time they're going to be, okay, doc, I understand your plan. I see where you're coming from. Let's do this.
I love that.
And in your practice that you have, we talked a little bit about technologies and stuff like that. Do you offer other kinds of complementary skincare, advanced skincare procedures that really help with like texture, tone, skin health? Because I feel like people, they go through their entire life and kind of forget about the skin being the largest organ, the largest external organ, let's say. And all of a sudden they wake up one day and they're like, oh my gosh, I have all of these fine lines and wrinkles, or I've lost volume in my face, or I've noticed like a change on my jawline. And they panic and they think, okay, I'm going to go in and do toxins or fillers. And we forget about all of the other, they don't even know, or they forget about all of the other things. How do you manage that? And what's your opinion on all that?
Well, I now manage my patient with what we call a 360 approach. We need to talk about skin quality. Skin quality is very important, and skin quality comes through skin health. So if you have any diseases that needs to be treated, this is something that I leave to the medical part, because don't forget, I'm just an ENT surgeon. I'm not a family doctor. I'm not an endocrinologist. So if you have any issues, you go see the right practitioner for that. But skin quality is very important. As you mentioned, the texture, the volume, the laxity, the color, the rosacea, melasma, brown spots and everything. It makes you look older, even if your face is filled. And you need to treat everything. So yes, we integrate, the injectable, and then we have the toxin, the fillers, the biostimulators, the skin boosters, the Kybella, anything you want to call it. We have it. I said Kybella, but I meant Belkyra.
Yes.
Yeah, Belkyra.
We understood. We got
it. And but we integrate lasers, micro needling with or without radio frequency. We have high intensity ultrasound, like the ultrotherapy. We have the thermage. We have CO2 lasers. We have the pulse dye laser. So this is all a thing that is integrated. So I strongly suggest my patient to take care of their skin quality, and that goes through all the other in-office therapies than injectable. And then you need to maintain those results with the skincare at home.
Oh,
so of course I'm going to suggest.
You're speaking our language.
So of course I'm going to suggest a skincare regimen depending on the need of the skin. But most of the time I have my trifecta is vitamin C, retinol, and SPF. So that's something that everyone should have, at least starting at 30, sometimes 25, but under that, most of the time, you just need the SPF and vitamin C. But that's it. So
I really love
the
that
whole thing
approach.
needs to be.
I really love that approach, because it's really a 360-degree approach. I see a lot of places or people that are just looking for, I just want to have Botox. I don't want to do anything else, or some type of a toxin. And they don't understand this. So it's a really important messaging is global, right? We talk about that all the time, just for health in general. You can't just do one thing to optimize or be the healthiest version of yourself. You really have to take it as a 360.
Yeah, exactly. It's like if you're training for, a run, You're not just going to run. You're going to treat your diet. You're going to sleep better. You're going to do some musculation. You're going to do maybe some stretching. So it's everything that's going to help you to have your objective in your run. It's the same thing with the skin. It's a marathon.
Well, I find consumers today are very, they're knowledgeable. They're I think much more knowledgeable. So it's great that they're able to, have this knowledge, but combine it with expertise in a 360-degree approach with someone like yourself, because it's not everywhere that's working with that dynamic. A lot of places are just like, we just do Botox and fillers, and they don't talk about the other things, or they just do the advanced technologies and facials, but they don't talk about the skincare at home. So it's a great message.
And ultimately, you'll just have happier patients because the results are going to be so much better, right? When you implement all the things. I think that's really great. So yeah, I mean, hats off to you. I want to know, where do you think the aesthetics is going to be going in the next 10 years with all of your knowledge?
I think we're going to go further into the regenerative medicine thing. I think it's actually growing. It's growing really fast, the industry. So the part of the industry that's working on research is going really, really fast. I think there's a lot of money behind that. That's why it's going so fast. But yes, we're talking about biostimulation right now, but I think we're going to go more about regeneration. So how can we regenerate the collagen? How can we reverse the aging process? So is it the telomeres that we have to lengthen? Is it something, the gene therapy? Is it peptides? What is it? I think it's going to go further into that, using science and making this more about turning back time. And if we turn back time in the skin, can we do that in the organs? Can we do that? Yeah. So I think this is what's going to be
I do hear,
Yeah.
I listen to a lot of podcasts, and there's a lot of people talking about that.
Yeah. And people are also, I think, associating that also with exosomes, right? If I'm not mistaken. Like, what's your opinion on exosomes?
So I feel like it's something that is really interesting. We're seeing results from everywhere, but I think we're missing just a little bit of more scientific solid proof that this is the thing. There's also no standardization regarding the product. So there's a gazillion brands of exosomes. So who tells me that this one is better than this one? Is it, if we do a study with this one, is it going to be the same result if I use this other brand? There's animal one, vegetable one,
human derived also.
Yeah, human ones that cannot be used in Canada anymore. So what is it? We need something, like, I'm going to use Botox because it's the oldest thing, but it's standardized. We know that Botox is always going to work this way. If you put that kind of units, it's going to react that way. We need that with exosome.
Yeah.
But I think it's getting there, but we're not quite there yet. So yes, I feel like it's nice for soothing the skin after a laser or soothing the skin after a micro needling. Some people, they do react well. They have less redness. The time healing is cut in half. Some people not. So why are those people not responding the same thing as the other one? So I think that's
the big
missing.
question.
Yeah.
That may be the source, or just how the body, how the messenger.
Yeah.
And
exactly.
so I wanted to ask you a question about that, because talking about the future in the next 10 years, because a lot of people are talking about AI and how AI is coming into the medical world. What are your thoughts on that? And what do you foresee? Or what do you have? Are you using any version of AI today? And what do you see happening in the future?
So I think as medical professional, you cannot go around the AI. It's like 20 years ago, if you were going around the internet, like you were missing something.
Yeah.
So I think you need to jump in it and use it. I think it needs more, regulation, so it just doesn't go free for all. But actually, I'm using it in my practice as an aesthetic physician for prediction of results and analysis of the face. So it's mostly to show patients. I know what it's going to look like. I know how it's going to react, but they don't. Sometimes people, they want to see a picture of what they're going to look like. It's like when you renovate a house and the designer and the architect are telling you it's going to look like this, and you just see a hole and all the walls open. You don't have the vision. So it's the same thing as that. So I use AI for that. I don't use medical scribe a lot because I feel like it takes away the fact that my brain is functioning while I'm typing my notes, so I don't use a lot of medical AI for that, the scribe. But I use it sometimes when I'm going to dictate my note afterwards and I'm going to correct it. So sometimes I use it like this.
Okay. Do you see it being something that's going to be a big part of medicine moving forward?
Yeah, I think it's going to be for some of my colleagues, not especially in aesthetic medicine, but in more family medicine, emergency.
Surgery?
It's helping them to write. Yeah, it's helping them to write the notes. I think it's already used in surgery so they can do, 3D models. For example, when we remove some ENT cancer, we remove the half of the mandible, we have to reconstruct that. So we're sending the scans, and then they can reconstruct through AI. They can reconstruct a model of a mandible bone, and again, they can produce the implant. So we have something that's specially fitted for the patient. So it gets a better result functionally and aesthetically. So it's already there. So it just needs to, be integrated.
Yeah,
but I don't think it's going to replace
time-wise
doctors
too, right? Like time-wise?
Yeah.
In making
Time management,
speeding up things and making things faster and more
Totally
productive. Yeah. Interesting.
I'm going to go off topic here because I'm actually just curious. This popped into my head, and it has to do with Botox. There's a woman that I spoke to recently, just like a regular woman, and she was interested in getting Botox done. And she had mentioned to me that there's apparently, which let's debunk this, I'm not sure if it's true or not, but apparently there's some studies that have been done that Botox can help with depression. And like when she mentioned this to me, I was like, of course it does. Like we're all happier when we have less wrinkles, like duh. But
no, but she's like, really, she has depression.
She was actually serious about it. And she unfortunately struggles with depression. And she was interested in getting Botox to potentially help with that. And I'm like, I'd have no idea who to ask. And I thought, well, it's perfect to ask you. Like, are there studies that link the two?
There's a study, actually, I think 1 or 2 study, and I didn't read them. I saw a lot of buzz on social media regarding that, especially for glabella and for headlines. I'm not sure, so I'm not going to be able to answer and give you a clear answer, but I know there's a study. I don't know if the study is good, if it's well constructed, if there's a lot of patient implicated. So the power of the study, I don't know, but I know there's one. So I'm going to read it, and maybe I'll make something on social media.
Yeah, it's an interesting thing because, we found out so much about Botox or talks in general about, if you have excessive sweating or migraines, lockjaw, like if you're grinding your teeth at night, there's so many things that have been discovered because of it. So you never know. Yeah. You never know. It'd be encouraging if it is.
I think that would just like skyrocket for a lot,
Absolutely.
Yeah, no, I thought that was really interesting because I'm like, in my mind, I wouldn't think that necessarily there is one, like chemically. I just am not well-versed enough to know, but I know that like on a surface level, one, I'm like, for sure cures, makes everybody happier,
Yeah, for sure.
I love it. It's actually so funny. I want to know what excites you the most about the future of healing in between both of your sort of industries that you work with. What excites you the most?
As I said, regenerative medicine is really interesting, but I think what excites me the most is that patients are getting more educated. So that makes them more open, and that makes my job easier. So I don't have to work twice as hard to get the same results on my patient. They're open. They're like, yes, I'm going to listen to your opinion. I understand that you're a professional, that you're an expert. So I think this education part is really, really important. Unfortunately, there's a lot of like misinformation on social media, but I think there's a lot of good information also. So at least if they come in and they ask their question and they're open to my answer that maybe it's going to go against their beliefs, that's fine. So the openness of patients.
Yeah. And it's important to give people something to think about, like to give them things that they have to go home and do their own research on and not just, like you said, following trends and stuff like that. All right. So do we want to go into our closing questions?
Yes, definitely. Okay. So it's kind of be like a rapid fire. So we're going to ask just a couple of questions. So whatever comes first to mind is what the answer will be. What is one thing you wish everyone knew about their own face?
they should know that their face is unique. Their face is their own. It doesn't need it doesn't need exactly the same recipe and treatment as their friend, their mother, their sister. It's going to be unique. So you need a personalized plan.
I love that.
I love that. That is a very
Everybody
good message. It's a very good message.
What is something you're still learning about yourself?
I'm still learning to manage work and family, this balance thing that, exactly, quote unquote balance. So I'm still learning how to balance with everything. Yeah.
I think that's a lifelong journey. Speaking from my own experience.
Yeah. I hear that balance is not even really a thing.
I know. What is balance?
Yeah.
It's a big
Exactly.
question.
So sometimes it's going to go, towards work. Sometimes it's going to go towards family. Sometimes you need to see friends. Sometimes you need to take care of yourself. So, there's no balance. They're just tug of war.
And I would imagine, I would imagine that in your line of work, being a surgeon and the type of patients that you see, it's not always very easy. So it's also the emotional balance. I would imagine of helping people and then, not taking it necessarily always home with you. But I imagine that would be very difficult.
Yeah. And it's not about taking it home with you. It's like you have an emotional tank and then you go through your day and then it's, slowly empties and then you go home and it's almost empty, but you still have to do your thing at home, the second shift. So it's more about that. So the emotional aspect sometimes is heavy.
Yeah,
for sure.
100%.
For sure. Now, finish this sentence. Feeling good in your skin is?
Feeling good in your skin?
Yeah. Point final. Mic drop. Feeling good in your skin is feeling good. Yeah. 100%. That makes total sense.
Yeah, it does. It's perfect.
The better you feel, like the better I feel, the better I look, the better
your
I
energy.
am.
Yeah. And your energy, when you feel good in your skin, it's everywhere around you. You attract.
Yeah. If you slept well, if you're well hydrated, you ate well, so your skin is going to be more glowing than if you don't sleep and you're eating not quite nice food and you're smoking. And you need to feel good inside to project the goodness outside.
Absolutely. I love that. That's great.
Thank you so much for today.
Yes. Thank you for joining us. It was really nice.
It was really nice to meet you.
Yeah.
Thank you for listening to Skin Talks.
If this episode inspired you, taught you something new, or just made you feel seen, please share with someone you love. And if you believe in thoughtful and empowering conversations that help you make better choices for yourself around your beauty and wellness, please rate and review the show. It helps us to grow our community, and we deeply appreciate it. Because this isn't just about skin.
It's about claiming your beauty, feeling strong, informed, and at home in yourself.
See you next week.